Coming back, we are going to take the last question. Panel, please.
Given the rising healthcare cost in Canada and given the rising aging population and the shortage of physicians, what is your party's plan to take care of the public healthcare system of Canada?
Well, thank you for the question, but there's actually 2 or 3 different segments of the same questions that we need to address. In the first instance, if you're talking about doctors, doctors need to serve in remote regions of Canada. That is where we have a shortage. And in this regard, the Conservative government will forgive them their training, the loan that they have used to train, and that will encourage them to serve in the more remote areas. In terms of foreign credentials of doctors that are coming from abroad, we have plans to fast-track and examine that to allow these foreign doctors who have the experience to come to Canada and to practice. And thirdly, in the overall health care, it is our policy to maintain a steady and consistent funding so that, unlike the previous Liberal government where there was downloading of the costs of health care. So that is our strategy.
Well, I tell you, healthcare is clearly hugely important to all Canadians. It's very important to people here in the GTA. There is a tremendous shortage of doctors here for everyone here in Toronto. Anyone who knows that trying to get a doctor is very difficult. So it's not just rural Canada. We've long supported extensions there too. But critically, the Liberal government, the Liberal Party rather, has said that we will continue full funding for health care beyond 2014. That is a critical commitment to make. The Harper government instead has waffled. Jim Flaherty, the finance minister, has in fact said that the funding will be subject to change. We don't know what that means. What we do know is that the budget that had been proposed and the now Harper platform is silent on what it would do for health care, but notably is missing billions of dollars that would otherwise go to health care. In 2014, the Liberal Party and the Liberal government has already committed it will continue funding for health care. We will work hand in hand with the provinces and the other jurisdictions that deal with health care. The Harper government has completely worked alone and ignored this. Remember that Stephen Harper, in an earlier time, in fact advocated doing away with public health care and wanted the entire system to be private. We are, as Liberals, 100% behind supporting health care, continuing to support the health care. The Harper government instead has waffled, has in fact not committed to continuing that, and in fact has suggested that that funding would be reduced. So we are very, very concerned about the Harper government's position. On the other hand, I will repeat, a Liberal government, absolutely 100% behind universal publicly funded health care.
Ms. Finney, I would not totally agree with that because I think it is the Conservative government's platform and strategy to respect universal health care. And I also may add that in part of the health care strategy is the prevention of illness. And in this regard, we have put in the fitness tax credit. This is encourage our children to be more fit, and I think prevention goes a long way in the impact it has on our health care.
But can I
ask?
Oh, sorry.
Is the Liberal then committed to the 6% escalator beyond 2014?
Yes. Short answer is yes. Michael Ignatieff has made that commitment formally that we will. But in addition to that, and I will say the Harper government clearly has not. They've said, in fact, funding is subject to change, and there's nothing in their platform to pay for it. But yes, the Liberal government 100% supportive.
No, we have consistently said that we will be consistent in our support of universal health care.
You have refused to make that commitment. Stephen Harper has refused, and in fact Jim Flaherty has suggested that the funding will in fact be subject to change.
Can I follow up with a question about in terms of internationally trained physicians? Mm-hmm. What is the commitment of your party to foreign trained physicians. What concrete plans are you putting in place? We've heard about access to trades and professions for more than 20 years. Not much has happened. I'd like to hear a concrete plan. I know Mr. Harper promised last Wednesday that $6 million loan would be made available to foreign immigrant professionals. However, we found out that it is not really a loan directly from the government. Rather, the $6 million loan would be a $6 million budget may be available to service provider organizations to help the professionals get loans from banks and financial institutions. We know that this is the settlement sector just received a $54 million cut to the entire sector in Canada. Ontario suffered a loss of $44 million in grant or in funding. So is the $6 million included in the cut that is to come next year? Because Mr. Kenney has promised there will be an additional 6% cut to immigrant services. So is the $6 million after the cut or before the cut?
No, I think those figures are incorrect. I think it is our consistent. It is our strategy to maintain consistent funding. It is our strategy to maintain the healthcare system to the benefit of all Canadians. And it is our. We will fast track and review the foreign credentials so that doctors that are coming in Canada can practice at the earliest opportunity.
But the challenge is that foreign credentials are often based on provincial organizations. So, for example, the medical associations, the engineering organizations. The Harper government promised 3 years ago to do something with foreign credentials. All they did was create an office staffed by a couple of people who then sent people to the provincial organizations as it was. They have done absolutely nothing. So we have said since before I was elected 3 years ago, I've been saying we need to have recognition of foreign credentials. But we also need to have the training so that people can use those credentials. No, even if somebody's medical degree is fully recognized, he or she cannot practice if they cannot function in the language properly, which is why settlement services are so critically important. And yes, the Harper government cut $54 million in settlement services, 80% of which will affect the GTA. These are critical services to, in fact, do everything for new Canadians to get those jobs, to utilize their foreign credentials, and it is completely hypocritical to say that somehow we're going to provide more funding, one, which is not credible because the Harper government has done nothing despite promises 3 years ago, and two, because you're taking with the left hand and we're not even sure if you're giving with the right hand because we're not clear on the details of all of this. It's very frustrating.
It is in a settlement service, it is not the government's position to train the doctor over again because they are already trained.
No, it's to help with language. It's to help.
It is a language, but if they are going to function in society, they should have those language skills.
I think we have a lot of newcomers who have the language skills and the credentials. What they don't have is the ability to be licensed in Ontario or in Canada. What would your government do if you were elected to make it easier for them to get the accreditation? It costs anywhere up to $25,000 for a professional to get the full accreditation. And after that, there's a lot of hurdles to get over in order to be licensed in Canada. What kind of program can you provide that will fast-track their accreditation?
I think the federal government is working with each individual provinces because these licensing bodies are provincially based. And it is our strategy to work with each individual province and and the international universities and so on in the foreign country to make sure that we can fast-track them in standards and equivalencies.
Yeah.
I know this is the case in accounting. I know this is the case in engineering because these are the two professions that I'm involved with. Excuse me.
I will say that I'll repeat that the accreditation itself is through professional organizations within the provinces. Yes. But to have, and with all respect to CS, to suggest that the federal government will work with the provinces, the number of times that Stephen Harper has met with all of the premiers in over 5 years, once. He has only met with the provincial premiers together once. The Liberals have a history of working with the provinces and the territories. You simply cannot move forward on this when you have multiple jurisdictions to move forward on the actual being able to get the jobs.
So we've got to stop here because we have more questions. So now let's have a break first.